endometriosis and the kidneys. In endo, we know we have such a thing as silent kidney loss. And there have been women that have shared that they have chronic kidney disease and endometriosis. And because of this lack of collaborations in hospitals, they've kind of been treated as separate or they're not looked at together at all. And the care is quite limited in this sense. So I guess questions to you, as an endometriosis specialist are, how does silent kidney loss happen? And despite it being called silent, are there any symptoms or I guess biomarkers that a patient should pay attention to?
Okay, well, this is a very, very good question. And yeah, silent kidney loss is not really silent because typically the patient will have lots of pelvic symptoms. So the kidney loss doesn't happen very often because endometriosis consumes the kidney tissue or anything like this. The kidney loss happens when the ureter, the little pipe which goes from the kidney to the bladder, draining the urine from kidney to the bladder,
Yes.
gets gradually obstructed. And if it gets gradually obstructed, the kidney becomes more and more dilated. And if you compare this with sudden situation, for example, someone passes the kidney stone, which obstructs the ureter, that's like a super severe pain. This is the pain which most people describe as like worst pain in their lives. And that's because it's a sudden blockage of drain from kidney to the bladder. And that's a kidney stone pain. When you have endo, the ureter is being narrowed year by year by year by year by year, and that becomes the kidney sort of trying to adapt to this blockage of drainage, which is gradual, and finally kidney becomes more and more distended because kidney cannot cope with this and can basically lose its whole tissue and function and become silently dead. So that's what endometriosis related kidney loss is. But most of the time these symptoms are happening, or lack of symptoms are happening, with strong pelvic pain, menstrual pain, and other endometriosis symptoms, right? And if you don't investigate the typical endo symptoms like menstrual pain, pain with micturition, pain with bowel function, bowel motion, or you try and investigate it, but you've been ignored and not scanned, because a simple MRI scan will show you that the ureter is dilated, that the ureter is compressed. But if nothing is done and you have severe nodular infiltrating endometriosis near your ureters, that can result in a silent, well, it's not silent, it's no symptoms from the kidney because kidney sort of is deteriorating slowly without major pain.
Have you come across many cases of endometriosis of the ureters or kidneys?
Yes, endometriosis of the ureters are very common.
Ah.
Well, in our center, yeah, because we're sort of concentrating these cases to us. But yes, I mean, we're doing maybe 5-6 reimplantations of the ureter for this very problem a year. But unfortunately, we also had to do some removals of the kidneys for that very problem as well.
Do you regularly catch it early enough before the kidney damage is done?
Yes, typically, yes. So if we see, if we have a symptomatic patient and we do endometriosis mapping with MRI, if we see dilated ureter, then it's a red flag for us to investigate the kidney. So we do another scan to assess the kidney function. Most of the time, we manage to identify the problem before kidney function starts to drop. But like I said, several times, not in 1 year, but several times where the kidney function is like less than 12%, you can't do anything with that kidney.
So in that case, when you just your reference to kidney function, if you have suspicions from imaging or symptoms about the kidney being affected by endometriosis, do you run any blood tests looking at kidney function?
Yes, so we do the blood test just to do the electrolyte studies, and that still can be normal, but because the other kidney can compensate, right? But what is needed to differentiate which kidney is working to which percentage is, the MAG3 scan, which is a much more sophisticated scan, which can separate right kidneys doing like 51%, left kidneys doing 49%. And that's a specialist scan which we do for these type of problems.
It's good to know that there are investigative methods because the women who obviously have it on their ureters and they're on 2-year wait lists for surgeries, or they've got chronic kidney disease and there's no idea if endometriosis is involved, at least they're aware that there are ways to investigate if they are able to go elsewhere.
Yeah, we become very excited if we see a dilated ureter on the imaging. That is a red flag.
That you need to act.
Yeah.
Yeah.